Good afternoon, everyone, or good morning, depending where you are on the planet. So it's currently 1 o'clock here in Pacific Daylight Time here in British Columbia, Canada, where Kristina, Mitz, and myself are. Kristina, of course, background is as nutrition therapist, and she works for Taymount Canada. Very well versed on gut floral transplant, but also now increasingly versed on things like SIBO and other challenges. And of course, we've been working together for a while because many of the things that happen within COVID-19 are a challenge. So anyway, welcome back. This is now a good opportunity if you want to share this with some other people in discussion point. We've had a lot of followers and we really appreciate that. We are going to change next week to Tuesday at 4 o'clock Pacific Daylight Time, so 3 hours later in the day. And then we will probably also switch to one session per week rather than the two. So on Thursdays, you will have some time off, however you want to do it. Our goal is to continue on with the COVID concepts, but also to continue on with the general health principles, many of which are outlined very well in the book, Solving the Brain Puzzle, that came out, of course, last year. So, okay, and we've had a suggestion. Thank you for that, Sandra. So if we use hashtags on Twitter, we may make it easier for people to find us. So we will start to work on that too.
I've been hashtagging integrative medicine, but maybe we should hashtag Dr. Bill Code and you can have your own hashtag.
Let's do that. Okay. Sure, sounds good. I always wanted to have my own hashtag, I guess. I never knew what they were until fairly recently. So we have some topics to cover. We're very open to general questions today. There's a few things that have come up. Kristina and I just read an interesting article called Can Gut Microbes Predict COVID-19 Severity? And the general gist of the article is that they can, and even more useful than things that we've already looked at, such as age, hypertension, C-reactive protein, which is, of course, a gauge of rough inflammation in the body. And I think the predisposing feature, if you take apart the pieces in the article, any of us that have effectively, I guess, an ongoing leaky gut are more prone to have lipopolysaccharide, which is, if you remember, it's the breakdown wall component from the gram-negative bacteria. Once it goes into the bloodstream, it raises all inflammation throughout the body, and it can precipitate brain problems, gut problems, heart problems, including atherosclerosis, and probably also extraclottability, which is one of the issues with COVID-19. And so it's the whole cascade is triggered from that. So, I hope that you've been able to go back through some of our discussion points, but in a short-term summary, the better you can heal your gut lining so that it isn't leaky, through the tight junctions being loosened up and proteins getting through, as well as these LPS particles or molecules, lipopolysaccharide, then you can keep your inflammation down and you will do much better in the presence of any illness, including the infectious illness, viruses, or even bacteria for that matter, because it'll get into a little bit of issues of H-Pylori and so on. We're going to talk about some of those today, but they all fit together. And how can you help your microbiome? Well, short story, get off gluten, get off glyphosate, maybe off dairy, and more fruits and vegetables for the fiber component, and almost zero processed foods. I missed organic. But organic also follows through because any herbicides and pesticides and things you're taking in are a problem. So I think with that, so you'd outlined it today that we would talk a little bit, and this is very good suggestions from Bruce, with regard to gastritis, H-Pylori, Candida, and even gastroparesis.
Right, so gastritis is simply inflammation of the lining of the stomach, which can occur either acutely or there can be a longer duration where symptoms are occurring. And symptoms might include pain, nausea, vomiting, bloating, loss of appetite, or heartburn. So that is what gastritis is, and that differs from gastroparesis. So we were also going to talk about gastroparesis, which is a slowing or a sluggish emptying of the stomach, which can also incur similar symptoms.
And just to give you a quick breakdown for most of you have experienced gastritis if you had too much alcohol to drink the night before. Okay? It's probably the most common cause of acute gastritis. And so, of course, one way to calm gastritis is to bring down the alcohol intake. You know, that's kind of a given. Not everybody will have twigged to that, unfortunately, but it really is quite dramatic. And in its worst case scenario, the gastritis is so severe, you even have bleeding, gastritis and vomiting and all those other pieces you mentioned. Yeah.
So you mentioned alcohol is one of the factors, but smoking would be another factor.
Yes.
Use of NSAIDs, so Advil or ibuprofen, maybe some of the stronger ones as well. Those can be triggering for gastritis. And then one of the big ones is H-Pylori infection.
Yeah, and so just on the NSAIDs for a minute, we also know that the NSAIDs, just as they irritate the stomach lining, they irritate the small intestine lining and hugely increase your leaky gut. So you might get, you think, a short-term benefit from the anti-inflammatory of ibuprofen and naproxen and the whole host of them, but you have a huge cost a few hours later. And not just your kidneys and liver, but also the lining of the gut and all the triggers that is a consequence of aggravating that feature. Sure. And I think we're going to go on to gastroparesis.
Well, I was going to ask you, would there even be a point in testing for gastritis itself, or do you think you should just start noticing if you're experiencing the symptoms and then maybe look to the different root causes?
Well, in almost all cases, it's worthwhile to just try and see if you can settle it down. But if it's chronic, weeks and months, then you should get it checked out because, of course, recurrent gastritis, aggravated, as we said, with alcohol and with smoking, and they're both additive, are also a huge trigger for irritable gastric cancer, okay? Cancer of the lining of the gut. Because anytime you irritate a group of cells in the body and there's really rapid dividing and trying to heal, you're going to up your risk of triggering a cancer. And so those are two of the known risk factors for gastric or stomach cancer: too much booze, chronically, and smoking for sure.
Right.
Yeah.
And so I did come across some research on gastritis and the microbiome, and they tied in some dietary pieces to that as well. And so actually specifically what they said was researchers have begun to define the potential role of the microbiota driving the pathogenesis of several intestinal and extra-intestinal diseases, including chronic gastritis, offering a potential therapeutic target for intervention. And so there are certain microbes that were affiliated even beyond H. pylori, and then of course nutritional suggestions as well. So like Bill already mentioned, you can increase your fiber intake, which is going to increase the beneficial microbes and help reduce those symptoms of gastritis. The researchers also mentioned a diet that's high in salt. So if you're eating a ton of salt, especially table salt, you're actually preventing the microbes from producing those short-chain fatty acids, which are so important to promoting a healthy intestinal environment. And then same goes for the processed foods and sugar-laden foods. Those would also prevent growth of the beneficial microbes.
And just to back that up, most of you know that over time we've decided we would salt our food, especially meat, and it would keep better. And it does, because it keeps the bacterial count down. But it also keeps down the bacterial count of your microbiome, which may or may not be beneficial, and usually is not beneficial. And I think to take that another step forward, you know, I think we also found, and I'm sure you'll get to this in a minute, but H. pylori is a really common entity within us, and it doesn't always mean we're going to get gastric ulcers and peptic ulcers. Yes, it was a brilliant thing that two family doctors in Australia discovered, and it took them 20 years, but they eventually convinced the world that it was a major trigger for peptic ulcers. In fact, finally got a Nobel Prize a very long time later, after one of them, of course, took on the infection himself and went on to prove it. So we will talk about that in context, but you've already learned a lot. Most E. coli's are fine. There's a few bad players. Most Clostridia is fine, but C. difficile is not. C. tetani, or tetanus, is not. So, and most of those can be within us in small amounts if we've got all the other competing team members in decent amounts.
Mm-hmm.
That's why we're back to our old saw: more diversity in food, everybody wins.
Right. So actually 2/3 of North Americans carry H. pylori with them, and the majority of the strains of H. pylori are not pathogenic. However, you will notice if you go on to the CDC or the Center for Disease and Disease Control, they have marked H. pylori actually as a carcinogen. It's the only microbe to be marked as a carcinogen, because if it is the pathogenic species, it can downstream lead to stomach cancer if it's not taken care of. But the chance of that happening is quite low. So you really, if you suspect H. pylori in yourself, make sure you go through the proper testing and find out whether it is a pathogenic strain or not, and whether or not it's worth treating.
Right, and the key thing is having symptoms. And if you can take what we're telling you today and calm your symptoms down right there, you probably don't have to keep going on for further workup. And I mean, we all know it's a big challenge to go in and see our doctor these days. That's going to ease a little, but it's still pretty bumpy in most parts of the world. And so if we can look after those pieces and get a better feeling for our own food, so much the better. Mm-hmm. So why don't we talk a bit about some of the ways to calm down it, or maybe before we go there, one of the papers you found talked really well about H. pylori. It's better calm down early than late, because it seems to wiggle down into the gut lining and become kind of a chronic player. Now that's what we don't want.
Yeah, so it can actually burrow itself into the lining of the stomach, and then it alters your stomach acid production. So that's how it works. It also secretes a special lipopolysaccharide. So we've talked a ton about lipopolysaccharides over the past few weeks. They're also, you might have heard us refer to them as LPS. So H. pylori has its own special LPS that it secretes, and that actually helps hide it from the immune system. So it sends out these molecules and attracts the attention of the immune system to those inflammatory molecules, and then it's able to hide itself from the immune system. So if you think of the different routes of testing for H. pylori, one of the routes of testing is through blood testing, and you're testing for the antigens. But if the immune system is busy targeting the LPS, then you might not actually have those antigens. So that's why they say if you're going to test H. pylori with a blood test, you're only really going to detect it earlier on. Yeah. But if you've had H. pylori for a while, then you're going to want to do some different types of testing. So there's the breath test, there's stool testing, and then I suppose you could use an endoscopy and look for the ulcers and do a biopsy.
You can, yeah, but I mean that's pretty interventional. And certainly in Canada, it's going to take you 6 months to see the gastroenterologist, and it's going to take another 3 to 6 months so they can set up your biopsy. And so that's a long time, folks. You'll want to be solving it yourself early on if you can.
That's a really good point.
Yeah.
And I do look at a lot of stool tests, and I do see H. pylori come up on the stool test, but it's actually not very frequently that I recommend a person move ahead with treatment, because I'm looking for the virulence factors as well. So if it's a well done stool test, you're going to see, did H. pylori actually appear? And then what are the virulence factors, which essentially are referring to the different strains of H. pylori. And there's maybe only ever been 1 or 2 cases where I've been like, okay, you need to take this to your doctor or your gastroenterologist and actually go through some form of treatment for this.
Well, that's right. And there's a big clue in that. And of course, those testings are done pretty much on the DNA of the stool, right? Let's let go mostly of our culture and sensitivity concepts, because most things coming out in stool or in your poops are definitely anaerobic, meaning they don't survive in the open air because there's oxygen in it. Consequently, you're not going to culture them. So you won't learn very much at all on a culture and sensitivity. It's a bit like looking for parasites, looking for live parasites in the stool, almost another waste of time because they almost all die on exposure to the air. So you may get a test where you said there was no results, but you haven't learned very much. So that's why it's a little more involved. And I don't think we're doing too many DNA testings on stool in Canada for a regular family doctor's request, but I think we can get them in more major circumstances, either infectious diseases or gastroenterology.
Right.
And we can maybe get the DNA testing. Otherwise, you're kind of thrown back on your own clinician ordering these for you and probably sending them south of the border.
Right.
Yeah.
So that being said, it's going to be better for you if you can help prevent H. pylori from overgrowing in the first place, and there are definitely a lot of things you can do in that regard. Some of the better options, at least nutrition-wise, would be to drink sugar-free cranberry juice on a regular basis. Increase your intake of sulforaphane. So sulforaphane is, you can find it in broccoli and broccoli sprouts in pretty decent quantities. Broccoli sprouts contain actually a lot of sulforaphane. If you're going to get it from broccoli, you have to keep in mind that the broccoli actually needs to be raw and not cooked to get the sulforaphane, which is why it's almost easier just to get it from broccoli sprouts or maybe even a supplement.
Mm-hmm.
Cabbage juice is another really good option for preventing H. pylori.
I've never had a glass.
I have.
Have you?
Yeah.
Do you quite like it?
It's okay.
I'll bet it's an acquired taste.
Yeah, I know one of the juice shops around here, they do cabbage juice.
And is it fresh?
Yeah.
Okay, so
yeah,
that would be quite fine. I mean, I like fresh cabbage, and that would be good. It's that time of year. Well, not quite yet, but we've started it growing, and we'll have some in a month or two.
You have to mix it with something because it's actually kind of spicy. So I find you need a bit of apple or celery or something else.
I think either one of those are a great blend, apple or celery.
Yeah, green tea is also a really good preventative for H. pylori, and really good to actually tack on to treatment if you are actively treating H. pylori.
And the one secret about green tea is you don't want it at full boiling to make it, because that'll break down some of the special molecules in it that we're trying to use. So I think we talk more about it somewhere like 80 degrees Celsius or maybe 170 Fahrenheit. So that's quite different. And if you're lucky, I mean, I've now got a tea caddy or a boiling water unit, allows me to pick which one to use.
That's perfect.
Yeah, which is a big help, because liking tea and not tolerating coffee, it's nice to have my own little spin on stuff.
Exactly. And then similarly to cranberries, so blueberries and elderberries contain similar polyphenols to cranberries, so they kind of work against H. pylori as well. And then there's also black seed, which is a spice, but you probably won't find it in the spice section of your grocery store. This is something you'd have to go to the health food store. I've been able to find it in the bulk section at our local health food store, and you get it as little seeds, and you can either keep it like that and put them on salads or whatever, but I actually grind them and use them almost like a pepper, and they do taste similar to pepper, so I quite like them.
Yeah, so it's one that we haven't adapted into, but I think we should, because I mean, pepper's got its own component in it, which really helps absorption of many other minerals and nutrients. But yeah.
Now, in terms of actually treating H. pylori, the standard treatment is the triple therapy. So you would take 2 antibiotics and an acid suppressor to help the antibiotics actually do their job. But that's going to be a pretty intense treatment, and you're going to end up wiping out a lot of your microbiota. So if you can try the herbal root, that might be worth your while, just in order to save your microbiome from being depleted from those antibiotics. So some of the suggestions for treating H. pylori with herbs would be berberine, and then also Pepto-Bismol. And then you can get the black seed that I just mentioned as a supplement so that it's even more potent. Mastic gum as well.
That's right.
And zinc carnosine.
Yeah, and so you can find those, and all of those are in a product called Pylorasil.
Mm-hmm.
I only know that now because I had to look it up. But it's got the mastic gum, it's got the zinc carnosine, and it has the, what's the third one you mentioned?
Probably bismuth.
Yeah, bismuth. And of course, bismuth is what's in pink, and so its nickname for Pepto-Bismol is pink bismuth. And so all three of those are in that product Pylorasil, which I think comes from variation of the word pylorus, which is of course kind of the relative valve between the stomach and the small intestine. That's the pylorus. And so it has each of those in it. And you can often get things to settle down a lot. And then of course the other thing is finding, what are the triggers in you as far as your diet habits or stress habits, because all of those will help bring those down too. I mean, I'm old enough now. We used to put people, when they had stress ulcers, they were put on a sippy diet, which was kind of a dairy cream almost, god awful if you don't like milk. But anyway, so we did that, and we put people on rest, and then we did a vagotomy and pyloroplasty, meaning we did a kind of a around the circuit thing surgically to move things through that area, and then we cut the vagus nerve. So if you can calm the vagus nerve, which you can do with, music, stress reduction, breathing techniques, all of these are ways that you can help cope with improved input from the vagus nerve. A lot simpler than cutting it. In fact, that almost disappeared. In fact, that triggers us into another hiccup in this whole challenge, into the antacids that we developed eventually. Because in the late 70s, we came up with the first H2 receptor antagonist, which was cimetidine, and then it went on, and the next one more popular was ranitidine, which we still have today, and you can often buy it over the counter in most of the world. Famotidine is in that same group. And then, as if those weren't potent enough, the pharmaceutical companies came on with protein pump inhibitors. So if the other one reduced acidity by 80 or 90%, protein pump inhibitors reduce acidity by 99%, almost 100. In fact, the fine print on them, if you look at it when you get it from the pharmacy, your first prescription is take no more than 3 months. But I've seen now hundreds of patients who've been on it for years.
Right.
And there's a nice little subtlety within that. And it's another good reason to get a copy of my book, because I really talk about protein pump inhibitors and how you can taper off them. Because you can't quit them cold turkey, because you get a huge rebound of pain, discomfort, the reason you maybe went on it in the first place. It's very clever marketing, isn't it? Because you can't take less than a whole pill, because that's how they come, or a capsule, and consequently you are better switching to ranitidine, as I talk about in the book, and then gradually tapering that down. But at the same time, find the solutions to solve the whole issue, as we're going to get to in a minute, so that you can do that. So that's in the chapter on drugs to take or not to take in my book, Solving the Brain Puzzle, which you can get in audio version. And thank you to the one of you that recently bought an audio version and a book version, because it will help all those pieces be outlined, and more particularly it'll help that. We also had a good question from Tony today. How can I find credible info on healing the gut? Well, you can talk and learn in the book about the microbiome. There's a major chapter, really well done, by a naturopath colleague of mine in Ontario. She wrote that chapter, and then I wrote the chapter on gut floral transplant, which is, the last stage. If you can't get your microbiome well enough to heal your leaky gut, and you've taken out all the nasties as far as the leaky gut, such as alcohol and stress and non-steroidal anti-inflammatory drugs, then gut floral transplant. And that's why I went for, I guess it's 3 years ago now, I went over to the UK, and I'm happy that we can offer the same service here in Canada now. But it's really come a long ways in healing leaky gut, and it's the secret of well-being, really.
And if you look to the internet for information on leaky gut, most of the solutions you're going to find on there are going to be things to help you soothe your gut. So, I mean, these are really helpful things. So, for example, if you were coming off of the PPIs, you could use things like licorice root and marshmallow root. Same thing if you were treating H. pylori. These things are really soothing to the gut, but they're not necessarily getting to the root of the issue, which is that in most cases people have dysbiosis, which is an imbalance of their microbiome. So you really want to figure out, is your microbiome imbalanced, what about it is imbalanced, and what things are contributing to that imbalance, and then work from there.
So you might need to see a consultant about it. You know, you can contact info@taymountcanada.com, get in touch with, you know, therapists like Kristina and her colleague Cindy, because they can start to coach you through those pieces of where to go, because it's a lot unending. If you're fortunate enough to have a very good functional medicine practitioner or integrative medicine practitioner, naturopath and so on, then you're able to also really get on the path. Because some of you will need no help and some of you will need considerable help, but it's worth it because it's the secret to bringing down inflammation throughout the body. And just as we said at the outline, at the outset, if you can keep your gut healthy, your microbiome very diverse, then your risk from downside with COVID-19 dramatically reduced. And you can make that difference in 2 to 4 weeks. So if you're looking at going back into the workforce or into the community and you're worried about what your risks are because of the things you've already got, you're the one who can change it. You know, so increase that diversity, get rid of the things we've talked about, you know, like the gluten and other toxins, you know, and like glyphosate, and you will already be starting to dramatically improve the lining of that gut and the healing the leaky gut.
Bruce is saying he's been checked for gastritis, has been negative each time for H. pylori. How accurate is the test for H. pylori? I assume you're speaking about the stool test. I don't have those numbers, but you can always reach out to the lab Diagnostic Solutions and just ask them about to what extent the test is accurate for H. pylori.
But you bring up a really good point, Bruce, because not everybody will have gastritis or those symptoms related to H. pylori. So if you've tried 3 times, and the other one, the breath test is pretty accurate, but you can get some misconceptions. So first of all, to deal with one like yours, where it's always come up negative, then it behooves you to try these other components to try and really calm those issues down. And so it may not be H. pylori because there's other things will trigger it, and we're going to get into bile and a few other things in a moment will help you find that. So if you've tried hard and you've got 3 negative tests, well, it may not be there. So that now it's probably time to get some different help or advice on it. I find this isn't particularly well understood by most family doctors. Gastroenterologists are often really good at it, but then it's about it. And because it's tricky to get into the gastroenterologist, you want to maybe work with one of that other group of people with the functional medicine expertise, such as naturopaths, physicians of that bent, and so on. So that would be, I think, a better way to go with it.
He's also saying H. pylori will add to the SIBO because it raises the pH of the stomach acid, correct? That is correct. So, I mean, anything that interferes with the pH of the stomach could also be triggering for the gastritis as well.
And you may need more stomach acid, not less.
Yeah, exactly.
Especially as we get older, and you know, I happen to know Bruce, he's roughly my age, he's a little younger than I am in all fairness to Bruce, but yeah, I mean, your acid secretion decreases over time, and so consequently you want to do things that will help it, either improve the secretion, improve the recovery from it, or even take betaine or something else which will boost it. It's only 30, 40 years ago, people used to be put on hydrochloric acid drops, and it was often a great help to them. And I would think some of the people that get put on propane pump inhibitors actually would do better with a little more acid, curiously enough.
Right, and so you mentioned bile, which is something I definitely wanted to talk about in relation to the gastritis, because if you have If you have bile secretions that are working their way back up into the stomach, that can also be triggering for gastritis. And usually if that is happening, that's happening because you have something like SIBO or gastroparesis. So because of the slow motility, the bile isn't working its way down. Instead, it's actually coming back up, irritating the stomach, and can even irritate the esophagus.
And Bruce has got a good related question. H-Pylori will probably increase your challenges with SIBO, and that's true, because as the H-Pylori bacteria kind of burrows down into the lining of the stomach, it's very hard on the cells, the parietal cells that secrete the acid.
Mm-hmm.
So acid goes down, which aggravates SIBO to a greater degree. So they are tied together very much so.
And Carla, I'm dealing with a severe lack of circulation in my lower legs. Besides nattokinase, what can I take or do?
Well, you know, you've done well, Carla, because you've already trigged to the hyperclotability possibility. And any of these are aggravated, as we know, with the acute infection of COVID or some other illness that's infectious, but also our chronic, you know, so-called autoimmune group are also compounded in that. I would look very intensively at additional supplemental oxygen to improve that circulation problem in the legs. That may make a huge difference. And then the other thing you might want to look at is healing of the gut lining, okay? Because anytime you heal the gut lining or heal the leaky gut, all of a sudden you bring down the lipopolysaccharide or LPS that we talked about earlier, and that brings down the inflammation in the vessels. Because remember, the blood flow through a tube is related to the fourth power of the radius. So if I take that tube and I make it half size, blood flow has gone down to 1/16. So any changes you make in the body, and this focus I'm talking about healing the leaky gut, will all of a sudden reduce the LPS or lipopolysaccharide, one of the big irritating triggers to inflammation in the blood vessels or atherosclerosis, and consequently you'll get better blood flow. All of a sudden better blood flow, better oxygenation. The other way to help beat the system is a little bit is adding that oxygen up to an increased amount. In a perfect world you do it with hyperbaric oxygen, but without that maybe you would do it with another method of so-called normal baric, and this means getting an oxygen concentrator at home and all those other possibilities therein. And then of course always exercise helps improve blood flow.
Mm-hmm. Jody is wondering, do you do private Skype calls? If so, how much would they cost? Well, if you are wanting to have a consultation from Dr. Code, you can email info@drcode.com. But if you're looking to have a consultation with myself or one of our other Tame Out Canada therapists, you can email info@tameoutcanada.com.
Yeah, you know, and it's drbillcode.com, because otherwise I don't know where drcode.com gets you. But yeah, have to have the bill in there, drbillcode.com. And of course that's the place where you can go for the previous podcast. Just look under blog or quite a host of podcasts, and we'll continue to have them there. And that's where you can send people if they're not on Facebook.
Mm-hmm. I guess we can speak a bit more to gastroparesis at this point.
Well, sure.
Yeah. So remember, gastroparesis is the sluggish emptying of the stomach. And so if you have food sitting there that starts to ferment, the microbes in the stomach start to ferment that food, they produce lactic acid. That's actually irritating to the stomach as well and can cause gastritis-like symptoms. I think it would be important to differentiate between whether or not you have gastroparesis or SIBO or both. So a lot of the root causes for gastroparesis and SIBO are actually quite similar and overlapping, but the treatment might be different. So gastroparesis might be a little more permanent than SIBO in some cases, and so you would want to see a specialist in regards to that.
And gastroparesis, until you think of something else, you have to think of elevated blood sugar and the onset of diabetes. I mean, the most common one is type 2. We know that gastroparesis, and this links back a little bit to my anesthesiology background, because gastroparesis means a full stomach, even though they've been fasting for their 4 or 6 hours or even longer. I mean, we used to see people, if they've got significant gastroparesis, it can come back, vomiting, biting you in the backside as you're inducing anesthesia, risking into the lungs and aspiration and all bad news, because that gastroparesis really slows things down. It's so dramatic that in people with known gastroparesis, we even circumvent it sometimes with medication, but also in the induction technique, because it really is a safety factor. Gastroparesis is more and more common because I think diabetes mellitus is now 4 times as common as it was 30 years ago.
Mm-hmm.
So it's going up like a rocket ship. And as we know, COVID-19 really hits diabetics hard. It really hits obesity hard. Obesity also associated with gastroparesis, unfortunately, but truly so. So these are all features which we can start to get a hold of, and we can dial the clock back. It won't happen overnight,
Mm-hmm.
but we can do it. So listen up, to the suggestions that she's making and try and improve that. Gastroparesis is mostly resolvable if you can resolve the underlying problem, but that'll take time. But if you control your diet and lifestyle well enough, you'll win.
Mm-hmm. And if it is because of something like blood sugar, that's definitely something that you can treat.
And it's well worth your while. I mean, the reason I wrote Solving the Brain Puzzle was to help you get in control or in front of your risk of Alzheimer's and Parkinson's and MS and stroke, because each of those are predicated and aggravated by the same set of problems. And if you can control them, you've got a better chance of a long and healthy, useful life with your brain, knowing who you are, which is, to me, one of the most important pieces.
Mm-hmm. So how do you find out if you have gastroparesis? Well, you can do the gastric emptying test. And so that's where your gastroenterologist is going to watch how long it takes for the liquids and solids to empty out of your stomach.
Yeah. So that's the objective test. If it feels like your food is still sitting there 2 or 3 hours later, short story, you've probably got gastroparesis to some degree. So if you listen to the pieces, all the things that will help it. Certainly if I'm going to have a huge meal, and I break down and do that at Thanksgiving and other times, I will help myself out ahead of time with digestion, often with digestive enzymes. Sometimes it'll also have ox bile, and I know we're going to talk about bile in a minute.
Mm-hmm.
Sometimes it will have a component which adds to the acidity, because every time you help the digestion to improve within the stomach, gastroparesis tends to resolve. And that's particularly important if there's a large fatty meal, because I think that triggers and aggravates gastroparesis.
Yeah.
A big fatty meal, which pretty tasty sometimes. I get that.
So some of the other causes besides diabetes for gastroparesis would include autoimmune disorders, or they call that the idiopathic gastroparesis, post-surgical complications, scleroderma, Parkinson's, collagen-related diseases such as Ehlers-Danlos syndrome or lupus. MS, or multiple sclerosis, is also considered a root cause of gastroparesis. Viral infections, especially viral gastroenteritis. Any upper gut infections, so like we've mentioned, SIBO. And so this can be bacterial, parasites, or even fungal upper gut issues. Medications can induce gastroparesis. Guillain-Barré syndrome, mitochondrial disorders, irregular gastric pacemaker activity, and bone marrow or other organ transplants can also trigger it.
Yeah, and sometimes that's the medications that they're due to, but a huge readjusting in the body once you've been through a major organ transplant, no question about it. So we've had one other question, and we will deal with this, I think, at some point in the future. So Sandra's asked about Kawasaki-like disease. So Kawasaki-like disease is a vasculitis within the blood vessels, and it seems to be triggered by COVID-19 in some cases, even in children. We'll spend a little more time on that, I think, in the future, because it'll fit well under the vascular sort of scenarios. Okay. Yeah, I think that's all we have for questions for now. So why don't we go a little bit into now talking about the bile issues. alluded to it already. I'm talking about using ox bile. So things that would make a difference in the bile production and so on. 'Cause I know we've covered a bit of that before, but I think it fits into here a little bit.
This definitely ties into gastroparesis, especially if SIBO is involved, which can either be upstream or downstream of having gastroparesis. So you'll remember that bile actually has some antimicrobial effects, so it helps keep the small intestine clear of too much growth of microbes, at least in most cases. And the older we get, the less bile we secrete, and we need regular secretions of bile throughout the day to help keep that small intestine in balance. And so one of the main components of bile is cholesterol. Another component is choline. And so cholesterol you're going to get from things like eggs. Choline you're going to get, again, from eggs or liver or soy. I would recommend fermented soy if you're doing soy. And then taurine is another component of bile, which you're going to get from your protein-rich foods.
Yeah, and so, I mean, eggs is my big favorite. I've talked about before, I do 2 to 3 per day. It's much better for me in all shapes and forms, but it also really looks after the healthy quality cholesterol as well as the choline, which is really important for a lot of other purposes. So that's my favorite. It's challenged to cook liver in our house because Denise doesn't like it at all. So that's fair enough. And we don't do very much soy. I mean, we will do some soy chips or soy, not so much chips, but the cooked beans. That's right, edamame.
Yeah,
so that's all good in small amounts. But I don't like GMO soy, of course. And of course, the one thing that really messes up badly our bile secretion and our liver health, as I've talked about before, is glyphosate. So don't hesitate. Learn where glyphosate is. It's in several times in the book because it's right there in spades in the detoxification chapter. It's right there in the general well-being and even in the microbiome because, of course, glyphosate, or other name is Roundup, is also an antibiotic. So it's really plays bad news on the whole microbiome.
Now, perhaps you have the building blocks for bile production. What about just stimulating its release? So the things that you can do to actually stimulate bile secretions to occur would be through eating bitter foods and drinks. So any dark leafy greens are going to be bitter and help stimulate that release. Think things like kale, Swiss chard, dandelion greens. You can also think of things like turmeric and cumin. Any sort of bitter spices, those are going to help as well. And then, of course, eating healthy fats are also going to trigger that release of bile.
And some of us, and Europeans have been much better at this than we have in North America, but they will use bitters, oral bitters, a teaspoon before a meal. And I know you suggested that one to me, and I've been taking it most meals because it really helps trigger up and gets the whole thing started. And this might be particularly worthwhile, probably if you're over 50, because all of those things start to diminish. I want you to improve your diet first, but if those aren't enough, then you might add that into the mix, and you might really start to get the stomach working better, the small intestine working better, and all the pieces, so that you won't have to go on to a long, lengthy healing journey if you can help it.
Okay, well, I mean, I hope that ties in the SIBO piece and sort of still talking about treatments for gastroparesis. So besides treating SIBO with gastroparesis, there are other recommendations as well. So if you really truly have gastroparesis, it's often recommended that you take some sort of elemental formula or liquid multivitamin or something like that, just to make sure you're getting adequate nutrition while you're treating it. Prokinetics are also a first line of treatment for gastroparesis, and so you'll remember from the SIBO videos that we did, we talked about the different Prokinetics and how each one would be prescribed based on the patient. So what strength of Prokinetic do you need? If you need a really strong one, you might use something like Linzess. If you have an autoimmune condition, you might use something like low-dose naltrexone. If you prefer herbal or natural Prokinetics, you can use different supplements, and most of the time they would contain something like bitters or artichoke extract or ginger or the vitamin B6.
And I think if we go to some of the other long time experiences. So I think of Ayurvedic medicine, I mean, one of the big four is bitters or bitter foods, and we don't do enough of them in our diet typically uh, because they're not as much. We've been heavily coached into what? Sugar, fat, and salt.
Yep.
So potato chips is the number one comfort food I would suggest in North America.
Yeah.
And consequently, it doesn't have any bitters in it, so it's not ideal.
Yeah.
Once in a while is a treat. Okay, fair enough. I do the same.
Right, and so I hope that is gastroparesis pretty well covered. Bruce, you can always throw up some questions if you still have any questions. But besides that, I know you had wanted us to speak to Candida, and so we can speak to Candida.
Yeah, I think we should start to introduce Candida. Candida is it's a tough topic, and I know in future we will do one on mycotoxins. Candida is a little bit separate to that, but it is a fungus. It's in the same group. I think Candida is a regular marker. It's a commensal, isn't it?
It is, yeah.
I mean, it's an ordinary thing to have some of in all of us. And the primary area for us is in the gut. And I know most clinicians think about it, well, when I see it in the mouth, that's thrush, that's Candida. When I see it in a vaginal infection, for example, starting the birth control pill, then yes, that's too much Candida and that's a vaginal infection, okay? But the seeding place where it almost always lives is in the gastrointestinal tract, and it gets off the map. If you end up on an antibiotic for any number of reasons, or an antibiotic-like substance, which would be the glyphosate, then that can trigger all the issues. And it's a challenge. We want it there as part of the team, but we don't want it to be running the whole show. And it doesn't take very much to tip it from commensal or cooperating part of the microbiome to one where it's taken up. So rather than beat it down, because we're trying to talk about the benefits of an even healthy terrain in the body, rather than these spikes or so-called germ theory only. And I know we're living in a time of germ theory only because we're talking so much about COVID-19, but the people that are going to do well with it that have a healthy terrain. And part of that terrain, as we've talked about, is the microbiome, but it's also everywhere on your skin surface and everywhere else.
Right, and I could honestly probably talk about Candida for hours because I have had Candida myself for a really long time, and for the longest time I was trying to just beat it down, and I was honestly on prescription antifungals for probably years at a time, which was completely horrible for my microbiome.
And hard on your liver too.
Hard on the liver, and it took me a long time to rebuild my microbiome after doing that to myself. And once I started to learn about the difference between treating the germ and treating the terrain, I started to pay less attention to Candida and more attention to the environment, and then the symptoms started decreasing from there. So Candida actually has some protective roles in the gastrointestinal tract. It helps protect the mucosa, helps create that fence. So remember, a good fence makes good neighbors, so we need a strong mucosal lining in order to make sure our immune system isn't overreacting. And the reality is that with Candida, it becomes imbalanced and acts virulent only if there are things triggering it to do so. So if you've taken antibiotics or if you have constant glyphosate exposure that's killing all of its friends and family and enemies that are surrounding it, then it's going to start to overgrow. And then there are things on top of that that would trigger it to actually behave more virulent. So Candida has different forms that it lives in. Its yeast form is actually its commensal form. And so if we do things that trigger it to enter into its hyphae form or some of these other forms, that's when it starts to behave badly. And some of the things that actually trigger it to do so are taking things like prescription antifungals. Some other things that can trigger it to behave virulently are actually oxalates, and it uses oxalates itself to behave more virulently. And so if you are someone who has low oxalobacter, which is one of the microbes that helps break down oxalates, you're not breaking down oxalates properly, then that actually might be something that's triggering the Candida to behave poorly.
Sure, and you know, oxalates, we've kind of edged into it, and it's really important because I know when we do the organic acid test, for example, at Great Plains, one of the reasons for higher oxalates is overgrowth of Candida. Okay, well, fair enough. but you have a lot of more control of your oxalate intake than many things. And it's a time of year we already think about it because we know it's really high in rhubarb. That's why we dare not eat rhubarb leaves, because they're so high in oxalic acid it injures the kidneys, even to poisoning the kidneys. But if we take that further, what would be other things that do it? Well, really high in oxalates is spinach and soy, the two S's, I guess, to call them that, or Swiss chard, the three S's. They're pretty high. And sure, so you won't be wanting to eat a whole massive meal of it if you're sensitive to it. Some people can eat anything, as you've long since learned. Just because you feel badly doesn't mean you're a bad person. It just means you've got a different variation in genetics. And so you need to work and find out within that. So minimizing what you'll take in. I still drink tea, but I don't drink 12 cups a day if I get by in a couple. And so it's high in oxalates. Berries, blackberries, raspberries, strawberries, pretty high in oxalates. It's a time of year, well, we're starting just to get into that time of year. And even if you're going to have a lot of them, or have a rhubarb crisp for dessert, you can vary the system by taking in a source of calcium or calcium magnesium. So you can do that with a supplement if you need to, or you can do it with foods that would do the same. If you're still doing dairy, then you could have some dairy with it, and you'll probably get away with it, because the calcium magnesium binds the oxalates and they go through out the bottom end. Okay? Problem solved. But if they're all absorbed, then you can have a whole host of problems, right from aggravating what you're talking about with the Candida, to some dramatically, it makes little sharp crystals within your muscles. And this can be hugely painful, and one of the big causes of pain in people that they don't recognize. They think everything must be gout if it's going to be a problem with crystals, but oxalates probably equivalent to maybe even a bigger problem commonly than gout. Uric acid.
There are also probiotics that can help reduce oxalates as well. So bifidobacteria and lactobacillus can also sometimes help break down oxalates.
So I think if you're into needing to be really careful with your oxalates, I would be on regular rotating types, of course, but bifidus bacteria or bifidus enhancing probiotics, and the same with lactobacillus, and fermented foods, which will have those in them too. I think it's harder to find a bifidus, fermented food, but lactobacillus is a big one.
Yeah, for sure. Well, the natto, actually, so if you're doing fermented soy, the natto products are great for boosting bifido. Now, if you think you have Candida, I would definitely encourage you to test, don't guess, because we do see people who they think they have Candida and it's actually something else completely. Histamine intolerance is sometimes something that gets confused with Candida because you get all of the sinus symptoms. And so that's something that's actually completely different. I would also think of, so we've mentioned some of the root causes of Candida behaving poorly, so that's oxalates and then not having a diverse enough microbiome. But some of the other things that could contribute to Candida behaving virulently or just the feeling of Candida symptoms would be heavy metal toxicity. I would also look to anything that compromises your immune system. So are you chronically taking steroids or immune suppressants? Cancer as well, unfortunately, can predispose you to having issues with Candida, as I actually unfortunately recently learned with a friend who had been suffering from Candida for years, and she just got her cancer diagnosis. So that all kind of came together and it made a lot of sense.
And I think we haven't mentioned it much today, but the microbiome starts in your mouth, okay? So if you're on an ordinary toothpaste, you've probably got something in there which acts as an antibiotic or even more poisonous, triclosan, okay, which is still in the majority of over-the-counter toothpastes, and that really damages all of the healthy microbiome within the mouth. So you've got 4 or 5 different regions within the mouth, and we'll spend a little more time on the microbiome. And you did a great paper on that. So if you go to drbillcode.com, you can learn more about it. Cindy, our colleague, has also worked on putting together, a toothpaste as well as a mouthwash. These are out of Dr. Curtola's books, and we give him credit for it. So you can start there, because if everything's healthier here and you're not poisoning the bacteria that are already going into, or not healthy bacteria going into the gut, the whole thing starts to work out better. So get the mouth looked after first.
Okay, why do so many GPs feel that GERD is the result of too much stomach acid rather than too little?
Well, I think we'd have to give part of that as a very successful marketing on behalf of the pharmaceutical companies, because for years it was billions of dollars protein pump inhibitors. They're designed, remember, for 3 months max, because they destroy all your mineral absorption and everything else, because you need the acidity for optimal digestion and absorption. Correspondingly, they're really hard to get off. So I think that's where a lot of it comes from, because it's an easy solution, and we've kind of been coached early on. I mean, I was naive when I started as a medical student, because I thought, get the diagnosis right, get the right pill, everybody's happily ever after. Well, it didn't work out that way, hardly at all. It seemed good at the time, and I thought, how am I going to learn all those drugs for each knee-jerk reaction? But it wasn't real. So it's well worth finding out, rather than going on a protein pump inhibitor, because it's going to have a tough cascade to aggravating things like SIBO, leaky gut, poor absorption of your minerals, and the whole cascade of being unwell. So I know it's a simple out at the time. If they're going to get you out of the office in 3 to 6 minutes, okay, fair enough, but it's not the solution for you. I want to empower you, and Kristina's on the same wavelength, empower you to look after your own well-being. So don't take a knee-jerk reaction of a pill for every ill, because it's not going to do you any long-term benefit, most often.
You reminded me by speaking about the proton pump inhibitors and the mineral absorption that actually just maintaining the mineral levels in your body also helps inhibit Candida. So your body has its own defenses against fungal overgrowth, and that includes minerals. So one of them is copper, and there are good forms of copper and there are bad forms of copper. And so one of the things that can disrupt this copper balance in the body is the oral contraceptive pill. So it can actually encourage the buildup of toxic copper, and then you end up being depleted of your body's beneficial forms of copper, which it helps, which it uses to keep the fungus away. I would also look to your levels of magnesium, of zinc, of selenium. Those are all really helpful things as well.
Yeah, and they're all messed up if you're doing the either glyphosate or the protein pump inhibitors. Worse yet, if you're doing both. So we've had a couple of good questions on the side. Alessandra's asked about oxalates and kidney stones, and yes, they are the base of most kidney stones. Whatever's out in front, it might be uric acid, it might be calcium, but oxalates are a relative factor in the whole kidney stone story. Jody's asked where things are for the recipe for the mouthwash.
It's not up yet.
It's not up yet. Okay, so it's coming soon. The one on mouthwash. We've tried it out in our group meetings, right? So we've tried it, and I didn't realize it wasn't on yet. So coming soon to a website near you. Okay, and I think that covers a lot of the questions.
Yep, that's all.
That's good, and we're getting up to the magic time. So because here in British Columbia, we're starting to have a little more openness, a little more opening. There's a little more, stores opening up, dental offices, physiotherapists, and assorted other things, including, the photobiomodulation clinic near us, and each of these features. And so we're going to shift now back to doing 1 unit a week of these, and we'll do them on Tuesday. I think we'll try with 4 o'clock on Tuesday, and that will allow people, because as they shift back into where they're going, that's of course will be 7 on Eastern time. It'll be, later in the day where you are. It'll be a little better for my Australian colleagues. But of course they are taped, and we are now moving forward to have them also in audio format. So if you go to drbillcode.com, go to under blog, and you can find them in either video, soon to be in audio format, and then you can collect them and listen to them as you want to. So we will start with those. Please send in your questions. We'll try and deal with them next week at 4 o'clock. And we will stay on the COVID-19. Next week, I see us as covering partly the vascular issues, because we want to talk about the Kawasaki type disease, which is a blood vessel problem, and the clotting issues. So we'll cover those again, because those are really important in us being good. In the meantime, be well, look after yourself, and as we talked about at the beginning, you get your microbiome healthier, you're going to do much better with your challenge with COVID-19 or any other virus. Yeah.
Right. Thank you everyone for listening, and don't forget to share the video with your community. We will see you on Tuesday.
Bye for now.